farm vertical with Dhan in Madurai, Tamil Nadu. We have Dr. Chandrakant Laharia, whose work is very well renowned, and especially for me as a student of public health, your work and contribution with the Mohalla clinics is of course very very well known. And we have Tejaswini. Tejaswini is currently an SBI fellow placed with MS Swaminathan Research Foundation in Kohli Hills in Tamil Nadu itself. So thank you everybody for being here. So on today's World Health Day, the theme is our planet, our Earth, and I mean, as we all know, WHO has said a lot of stuff about this, but part of it is based in the fact that a well-being economy is based in equity and ecological sustainability, and of course, to break a lot of these cycles of destruction, human health requires specifically legislative action, corporate reform, and also for individuals to be supported and incentivized to make these choices. So I think I'd like to begin by inviting Dr. Laharia to tell us about, what can be done in the current capacities of implementing, organizations to strengthen policies on the ground.
Thank you very much for the invitation. One of the point to remember is that which we had not recognized for really long, that we cannot separate environmental or and human health. We cannot separate planetary health and human health. We know that the plastics and pollutants have reached to the deep sea and highest of the mountains, and in various forms they are returning to the human food chain. So what is degrading environment is also degrading human health as well. Similarly, we know that some of the practices which has resulted in deforestation or rapid urbanization essentially means the rising temperatures, changing climatic condition, which essentially means heat stroke and other conditions, but also the pathogens and other are emerging or surviving in the setting where they were not surviving earlier. So these are the challenges which are widely recognized. Now, in the name of development, we cannot keep saying that we have to do this. There is always a possibility of finding the right balance. So, what is required? The first thing is that we identify the challenge, we identify the problem, which slowly being recognized, and that is a good start for me. Now, how this can be achieved, can be done. This can be only achieved when problem is recognized and the political leadership or government start taking action, but also citizens contribute to that process. Citizens also demand from the government. What government should do? Government should definitely improve, focus upon, as an example, formulate those policies and roadmap where environmental degradation is avoided in any which way. So focus and attention on solar energy, electrical vehicles. All of those will reduce use of fossil fuels, ensuring easy accessibility of clean energy, and ensuring plastics. I want to give an example. The tobacco farming and tobacco consumption both are really harmful for the environment, and human health. One side is that to prepare 6 trillion tobacco cigarettes or BDs, every year around 600 million trees are cut down. So to produce cigarette, you cut down the tree. Now, what is the harm? Like by smoking those cigarettes or BD, individual is getting harmful health effect. But because the trees have been cut down in the process, so there is environmental harm, and the trees which could have purified environmental air are not doing this. So there is a lot of interlinkage between these things. So the corporates and those entities need to be held accountable for those things. Final part is about human behavior. As an individual citizen, we can actually adopt a healthier lifestyle, refuse to eat junk food or all those harmful products. We should not. Can adopt those lifestyle where we can carry the bag and that reduce the use of single-use plastics. We can stop smoking, we can use cycling, but all of those require coordinated action between the government. It's easier said than done. We say that people should use footpath, but cities are not designed so people can walk on the footpath, or footpath are not available. There was an article which said that cities lately are designed for the cars rather than for human beings, and we need to reverse that challenge. The urban planning need to focus, and that's where role of policymaker. Urban planning to need to focus upon many things, but as an example, the urban planning need to focus upon ensuring footpath in all the city, cycling path on the cities, and then citizens should be encouraged to use those footpaths and cycling, increasing urban transport which is easily accessible to different parts and by the government, and then citizens start using those urban public transport. That's how we can tackle climate challenge, and that's how we can improve health, and that's linked to the planetary health and human health.
Right. Thank you for sharing, those very insightful ideas, sir. I would like to move on to Rajapandian, sir. And sir, my question to you is, like all the ideas that Dr. Laharia just shared, given your experience with Suham and Dhan, how can we sort of translate these ideas to action from, a ground up perspective? So please unmute yourself, sir. Yeah,
Yeah, sorry.
yeah,
We cannot differentiate this health of the planet and the human beings, health of the human beings, as rightly pointed out by Dr. Chandrakant. Basically, Don, we are following the approach of the community-centered approach, where the community is putting in front. So they will be given a responsibility. They will be given a kind of organizing them into the groups, and the groups will be taking a responsibility. Always the community should be looked as like a beneficiary, but it should not be. But the community is one of the major stakeholder. The community should be taken in front. So that is what the concept we are working in that. So basically, we follow the approach like we are making the community kind of demand stream. So how the demand stream will work? The demand stream work with the enabling stream. The demand stream work with the supply stream. Basically, the government will be the supply stream, where the community will be like a demand stream. They will be demanding where organization like a DAN or a SBI Foundation, those kind of the civil society organizations, so they will be enable the community to take this initiative forward. That is a kind of the actions we can ensure it. And moreover, the community should be a participatory in the forums that developed by the systems of the government. So most of the areas the community is not being discussed or consulted. So where the community should be consulted and the community should be in take in front. So basically we follow the approach like the steering committee method. So where the steering committee, where the community will be the one of the participatory and the functionary. So they will be taking responsibility. But a recent scenario, we developed a model by involving the government, the state governments. It's called health assemblies. The health assemblies are taking the agenda forward by involving the community participation. That is what actually, because we are encouraging the actions of the government should be taken into the grassroots level. So otherwise, so if we talk only in the level of top management, definitely it will not be reaching out to the community. So there are a lot of initiatives, even it's a greening of the planet, or otherwise plastic is a controlling the plastics, or otherwise soil health. These are the major impact areas that we need to look at it for saving the planet as well as saving the community, as well as especially the downtrodden community. That's what. Thank you.
thank you, sir, and thank you so much for like very briefly sort of mentioning everything that needs to be done and the involvement of grassroots and how the health of the planet is so interlinked to our individual health as well. Moving forward with the grassroots perspective, we have Tejaswini with us. Tejaswini, thank you for being here. So since as we all know that the SBI Fellowship is all about being part of rural communities and sort of being engaged in grassroots community action. So from your perspective and your experiences in your time at the SBI Fellowship, what do you see as a very the foremost challenge, if I may, as someone who's a lone community mobilizer, to inculcate the behavior change that is sort of like the need of the hour, as both Dr. Laharia and Sir have rightly pointed out, right? Like, I mean, we've all worked with communities, we all understand that like change is imminent and change is required. But as someone who's working directly with the community, what is a perspective that you can share on how to bring about that change?
Hi, Janvi. Thank you so much for the question. So, since we're talking about health here and on the occasion of World Health Day, the thing that I would like to talk about today is traditional diets, which, in my perspective, are going to go a long way in inculcating good health into the rural communities. The nutrition and health of a population, especially in a large agrarian community and country like India, rests on its food and agricultural system. Traditional diets in India are nutritionally diverse and have evolved from a self reliant, decentralized system today. In India, 14% of total population is undernourished. To the good health and well being of rural communities. 15 to 20 years back, millets like foxtail millet, ragi, which is little millet, featured extensively in the traditional diets of the tribals of Holy Hills. But over the time, the cropping pattern has changed from the traditional millets to more commercial cropping patterns such as coffee and pepper, which gives them more money. Hence, the observation that I made ultimately was that women over the age of 40 are healthier, have a better body structure, and better immunity. They are taller also, as compared to the younger generation between 20 to 35, who have stopped consuming millet, who are much shorter, much thinner, and have a very weak body structure. The shift from cropping patterns has led to a steep decline in the millet agriculture here, and hence today the quantity of millets present in households is very, very less. The effect of the loss of traditional diets can today be seen manifesting more and more in the younger generation as compared to the older one. The adolescent girls in my village that I work in are mostly quite short, very thin, and all of them, as I acquired the data from the HSC, are quite anemic as well. The same case is with most of their mothers, that they're all very anemic and underweight. The younger generation of women also happened to tell me that the pregnancies for them were much difficult and the miscarriages featured more in them as they had a shorter and a weaker body structure as compared to a little older generation of women who did eat and consume millets at one point of time in their lives, which is the traditional food of Koli Hills. Over the years, they have completely shifted to rice, and hence earlier when they would grow vegetables and fruits along with millets, today they grow only rice and other commercial products. They have to buy their vegetables, which increases the burden on them because the income is very less, and hence they end up consuming less of it ultimately. When asked about the production and consumption of millet, the two most common answers I got were that millet processing is very difficult and the taste palette of Holy Hills, surprisingly, is also changing a lot. The block medical officer also happened to tell me that the shift from traditional practices has also happened because apparently people are now preferring more restaurant like city like food, which has also led to them having hypertension and diabetes, which was not present earlier in them. The women also continue to constantly complain about headache and backaches in them. A 2-year-old child in my village today cannot walk, cannot stand because his mother was anemic because she was not eating properly. And today he also lacks that same nutritious diet which was present for his grandparents maybe before him. So that is one of the loss of traditional diet and loss of traditional practices is one of the major concerns in rural Indian healthcare right now. The shift to that, a shift back to the traditional diets according to the geography, according to the climate which was present, is extremely required for a better and a sustainable healthcare system. Thus, I have based my project, Elevation in Anemia and Enhancement of Nutrition, to try and make that way and chart that path back to the same. Thank you so much.
Right, all right. That was a very detailed insight to your experience and your project, and thank you for that, Tejaswini. Going back to Dr. Laharia, Dr. Laharia, from a very policy perspective, right? And I would like to also, sort of, uh, mentioned this, that my question to you is pertaining to mental health. So from a policy perspective, like we are seeing that public health and the climate health are very closely interlinked, right? So where how do we fit, like how does mental health fit into this picture? And you know what is the what according to you is the correlation between policy, mental health and climate change?
I think this is very relevant question, and often we ignore that in a climate related challenges or climate health, mental health is largely ignored. The reason is very simple. Like if person has a typhoid or diarrhea, they will come up with the health problem, symptoms of fever or loose motion or something, which is easily identified, recognized. But how to identify a person who is influenced by climate related changes? The heat stroke or the excessive temperature might result in excessive mental stress in an individual or senior citizen who is living in the home. Poor, unsafe drinking water is a lot of mental stress for the family and women in the family because they have to fetch the water or search for the water. The the drought is a key challenge for farmers because they are worried about their produce or uh, in the production of the farming facilities, which affect mental health. So, mental health is a key and severe impact of climate related changes, and which we should recognize upfront. One of the things which we should remember that in COVID-19 pandemic, while there was a health impact, equally or even bigger impact has been on the mental health. But pandemic has been a challenge. But one of the good part, like we always look at the silver lining in everything in the life. One of the good part of pandemic is that now people have started upfront talking about mental health more easily or more comfortably than they were doing before pandemic period. There is a government attention on improving mental health care services. So pandemic challenge has brought some attention on mental health care services. And I would like to argue that even climate health has a mental health related impact, and we should combine two. We should think in the terms of improving, identifying the mental health impact of climate change, also ensuring that mental health services are available in those settings which are affected by climate related aspects, environmental related challenges, or water pollution, air pollution. All of those have a lot of stress. Like if there are cities polluted, air quality is poor in the city, parents are worried about their children. Of course, there is a health impact of poor air quality or air pollution, water pollution, soil pollution, which is for different set of population. But there is a mental health impact for the entire society. We need to recognize, put this upfront, and whenever such kind of investment analysis, people are making case that okay, this is not worth investing. Such investment cost benefit or on any type of cost analysis, we should factor in that environmental or climate change are having a mental health impact. We should focus upon stopping that environmental challenge or climate change, but we should also invest in strengthening mental health services.
Right. So Rajapandian sir, in your experiences like with Dhan, and Dhan is very closely related to its work with the community, right? So when sir is like when Dr. Arya is talking about bringing about mental health policy, or bringing how intricate that is with also climate change, how do you think these policies can be effective on ground? Like what is a community perspective you can offer on that?
Yeah. Basically, the policies have been dealt with the system of government, and also the policy kind of the advocacies has to be come from this the field level. Always the problem of the implementing the policy is a major issue. So that means the policy should be in a practice. How do you make a policy should be in a practice? So it is with not only with the system of government, it is always with the system of this civil society. That means all the stakeholders who are the part of this making or advocating this policy, they all should be participating in that. So without that, we cannot implement the policies at a grassroots level. That's first point. The second point is that, but if you want to make a policy forum, because we should be developing kind of a policy forum by involving the stakeholders. So this is what Don is doing always. Always Dan is doing that, actually working in partnership. So we will not work in alone. Actually, we work with a partnership, and we ensure that, so what could be the policies should be come from, actually that come from the people system. The people system has to be strengthened. The people system, so whenever we strengthen the people system, the policies will be evolved from the community themselves. Those kind of the policies should be taken to the next level. So where this policy forums are developed at various levels, so they should be taken some kind of the responsibility. Like for example, in our system, the financial policies for the grassroots level, for example. So it is being implemented by involving the community, and the community will be taking a major stake on that. So they will be taking the responsibility. So how do we keep a responsibility with each and every stakeholders? That is one of the major area. So that the policy forums should be developed for implementing the policy or monitoring the policies at a certain level. So that is also a very, very critical thing. That is what Dan is doing, and Dan is practicing it. That's the one. That's a second point. The third is on, actually, because by building on the responses of the stages for me, I would like to add one or two points. One is the local food system. How do we strengthen the local food system? Because in our ancient period, actually, because we are following it's a very good system of food, because which will not create any side effects at all. So those kind of the local food system has to be identified. At present, actually, we are working very intensively on this particular aspect for safeguarding the planet, for safeguarding the health of the community, and where the small millets will be playing a major role. That's one area. It's small millets, but other kind of the plants and the material should be identified for vitalizing this local food system and practices. That's one of the major area. And one more point is that the sanitation and hygiene part, it's one of the major area that we should not forget it. Because one area is on health, that's fine. The medical is another area, but the sanitation and the hygiene practices of the community, that should be ensured, not only at the grassroots level, at different levels of people. Even with the kind of the elite people, we have hygiene practice. Still, it is a lacuna, one of the major area of lacuna. So that how do we connect this sanitation and safe water, mainly for ensuring the health of the community and ensuring the health of the planet? It's very, very critical. It is mainly to contributing to the environmental hygiene and environmental health of the particular planet. That is very, very critical. So that the role of the stakeholders are very, very critical. All the stakeholders are very critical in implementing the policies of the government, and also the stakeholders also should come with the policies, should be framed and also given to the government for implementation. That is also important. Both of it.
Right. Thank you for that very insightful response, sir. Coming back to you, Tejaswini, again, my question is about, again, related to your experiences. So, if quickly you could tell me, right, what do you think is one activity that, from an implementation point of view, we can do on ground, whether that's community engagement, community mobilization, NGOs being more present, policymakers going to the ground themselves. What do you think, addresses that one little crux that, can make policies more effective on ground?
I think that way or through some sort of a scheme that works for them, I think that will be one of the best practices. Something similar that MS Swaminathan Research Foundation is also doing on ground in Koli Hills is that it has encouraged and mobilized a lot of farmers to grow millets and are working actively towards food security on the very grassroots and a very centralized level. They have started processing mills so that the farmers and the locals find it easier to process their millet and make it into products such as ragi malt, which is a very healthy drink. They have also been trying to actively promote it through its FPOs as well. So policy is one part, but I think that the communities already know that what is important from them, what is healthy, what is not. I think they just need to be redirected towards it. The faith needs to be reinstilled in them that their traditional food practices are much better than what they are practicing today. Something that we are actively trying to do on ground. One part of my project is also to introduce quick, easy recipes for ragis for their day to day consumption in their household. So one part, I think ultimately it has to come from the community itself, where they itself recognize the importance of their own local traditional food, and they go back to it directly on their own. Only then
Right.
can a behavioral change can be made. Only then can a policy be also implemented.
All right. Thank you for that. Thank you for that, Tejaswini. That was very helpful.
Thank
And
you.
unfortunately, Dr. Laharia had a prior commitment because of which she had to drop out, before I could sort of just, close the session. Thank you, sir. Thank you, Tejaswini. Thank you so much for your time. I'm sure we can, these discussions can, go on because each of these have like volumes to be discussed about. And again, I would like to sort of acknowledge the help that we've received from Tanya and Urvashi from Altrois. So thank you, Tanya and Urvashi. And yeah, hope you guys have a good World Health Day. Thank you for being here.
Thank you so much.
Yeah,
Thanks a lot.
thank you, sir.
Yeah, thank you, Janvi. Thank you,
Thanks.
Urvashi.
Yes, thank you.
Thank you, Tejaswini.
Thank you,
Bye.
sir. Thank you.